In this presentation, I'm going to cover the levels of evidence. So in this week, what you're going to do for your CAT, your critical analysis topics paper, is you're going to determine a level of evidence for each article. And then you'll also discuss the grades of recommendation for all your articles. So in this presentation, I'm just going to cover levels of evidence. So as a reminder, we have these 5 steps that we're working on. We've already developed a searchable clinical question. That's our PICO question. You found your articles, your best evidence, and now we're starting to appraise the evidence. So that's the step we're at, and then we'll talk about these other steps as we move forward. So we appraise the evidence. So what we're doing here is determining how good is your articles to answer your specific clinical question, your PICO question. And we're going to talk about over this week and next week, levels of evidence. Actually, what we're going to use is the CEBM, levels of evidence document, the strength of recommendation taxonomy or SORT. And next week, we'll talk about critical appraisals. I'm not going to really talk about that in this presentation. So let me first compare and contrast the levels of evidence and grades of recommendation. So the levels of evidence are typically 1 through 5, 1 being the best and 5 being the worst. And we do a critical evaluation of the research article to rate the quality of that evidence based on the design of the study. It also is meant to describe the validity of the study. It does not necessarily consider the clinical applicability. Remember validity and reliability. Something that is valid, it actually measures what it says it's supposed to measure, and reliable is something that repeatedly measures something. And so for this work, there are different scales for levels of evidence. We're going to use the Oxford Center for Evidence-Based scale, which I have in the class, and then we'll be looking at on the screen here in just a little bit. Whereas the grades of recommendation are a letter grading, ABC, and we assign these grades to the entire group of articles that you're going to use for your CAT paper. So it's just not one particular article that you're grading, whereas in a level of evidence, we give a number value for each article, whereas in the grades of recommendation, the 4 to 5 articles that you're using to complete your CAT assignment, that's the grade we give for the total article. In addition to validity of the studies, it also considers the cost, the ease of implementation, and the reproducibility of other clinical settings. And again, there are several scales. We're going to use the strength of recommendation taxonomy. Okay, so right now we're just going to talk about levels of evidence, and then next presentation I'll talk about the strength of recommendation. So the Center for Evidence-Based Medicine in Oxford developed this scale that we're going to use. And so let me click over here. This is the actual document that you're going to use to rate the levels of evidence. And so we have these typical types of clinical questions that we've already developed, all these different things. I'm not going to spend too much time here. Okay, so I'm going to skip that and go to what's really important here is our levels. We have level 1, 2, 3, 4, 5. Level 1 is typically our systematic reviews or meta-analyses. Level 2 typically is a random control trial, inception, cohort, cross-sectional studies. Level 3s are cohort studies. Level 3 or 4, case studies, case reports, case control. And level 5s you really shouldn't be using. And so that's what this document is going to go over. We're going to spend some time on how to interpret this document here in a second. So first, this slide goes along with this slide. Okay, determining the study design. What is the aim of the study? Okay, what was the aim of the study? Question 1. Was the aim to describe the population? That would be descriptive. Or was it to quantify a relationship between factors? Or were we trying to determine differences between groups? So that's going to be descriptive versus analytic. So question 2 under analytic. If analytic was the intervention or the study randomly allocated, what that means is were the groups that were put in, the control group in experimental group 1, experimental group 2, were they randomly placed into those groups? If yes, it's a random control trial. If they were not randomly allocated to the experimental group, then it's an observational study. Whoops, hit the wrong button. So is experimental, randomize. According to this thing is observational, and we have these other types of studies. I keep hitting the wrong button. Question 3. I'm going to make you sick. Question 3 here. We're going to this area. When were the outcomes determined? So when were the dependent variables? Sometime after the exposure or the intervention. So do we make the determination what the outcomes for that particular study were done? Were they done after the fact? So that would be typically under a cohort type study at the same time. So when was the outcomes given? So that's probably a better way to think. Was it after the exposure? So somebody's already hurt and then we're trying to figure out if our intervention worked. Typically that's a cohort study. At the same time as our intervention, cross-sectional. So this would be like a doing the experimental design or the experiment all at the same time of your participants. Or was the outcome before the exposure was determined? So this is before the fact. So we have after the fact, at the same time, and before. So these are the different types of studies that you can have here. So some terminology: descriptive, non-analytic, describes what is happening in a population, does not try to quantify the relationship. In our textbook, this will be the type of descriptive research studies, designs. So we're not trying to compare, is one group doing better than another group? We're just describing what's going on there. Whereas an analytic, which is more experimental design, it tries to quantify a relationship between two factors, we say variable, the intervention or exposure, and the outcome. So we're either trying to determine a relationship between those two or trying to see if there's a cause and effect between those independent variables and dependent variables. Okay. Observational analytic, the researcher measures the outcome of the intervention or exposure. Or experimental, the research allocates participants to an intervention or experimental group. So that's our experimental design, is the experimental one. Observational analytic, researcher measures the outcome of the intervention. They're very similar. Prospective follows the participants over time during the study period. Retrospective looks back. Information is collected about the participants' past. This may be participant survey or a chart review. Crossover, each participant has both interventions. They serve as their own control. Okay, all that to say, to get to the important part here. We're going to talk about the different steps and how do we determine if the article that we're looking at is step level 1, 2, level 3, level 4, or level 5. No, none of our stuff should be level 5, okay? So we can typically are going to fall between 1, 2, 3, and we might have a 4. You'd rather not have a 4, but you may have a 4. So level 1 are systematic reviews. It's the highest level of evidence. As you've been reading some of these already, they're the critical assessment of all existing data up to this point. This includes a systematic, exhaustive literature search. It appraises the quality of each included study that they're reviewing, and it reports in a systematic manner. These are, again, the highest level. Now, it may include a meta-analysis, and again, systematic reviews and meta-analysis are considered original research. So if we look at here, I think that comes up in a bit. So level 2, cross-sectional studies. The data is collected at one particular point in time. Inception cohort study, a designated group of participants with an injury, or disorder are followed beginning at the initial diagnosis. So we're trying to see how they do over time. And our RTCs, subjects are randomly assigned to 2 or more groups, control group and experimental group. So that's level 2 types of studies. Level 3, so if we go here, we're in individual cross-sectional studies with consistency applied, inception cohorts, randomized, all these type of things here, okay? Cohort, observe a subset of a large number of people over a period of time, or they can be a non-local random sample, non-consecutive studies, studies without consistently applied reference standards, cohort studies, non-randomized controlled cohort. So these are studies that are not typically have any kind of randomization in the selection of participants or placing people into the experimental groups. Case level 4 or case series, a group or series of case reports involving patients given a similar treatment. Usually contains detailed information about an individual patients. Case studies, case reports, one patient with a unique case, injury mechanism, those type of things, and is reported in depth. And case control study, patients with an injury are compared to an appropriate groups of controls without the injury. So that's level 4. So what you have to look at with your articles for your assignment is where did they follow? I'm not going to even talk about level 5 because you shouldn't have any of these. Qualitative research, generally used to describe or explain. We've talked about this in our class, or we will be talking about it. It's data is collected through observation, interviews, or focus groups. Data are examined for emerging themes. And another type thing we've talked about here is review articles, literature review. This is non-systematic or reviews a topic. They may be peer-reviewed, but they are not original research. This can include like some of our NATA clinical commentaries or current concepts. And our CATs are not original research. Okay, I'm not going to talk about more than that. Okay, we'll talk about grades of recommendation in a second. Again, so what you want to do with your articles is determine, is each article level 1, level 2, level 3, level 4, level 5. From in the assignment, for this week's assignment, what you're going to do is in the table, all you need to address is, you just say level 1, level 2, level 3 for each article. So you don't need to explain that in the write-up portion. You would say that Smith et al. Is considered a level 1 level 1 evidence because it is a systematic review, or it's considered a level 2 level of evidence because it's a random control trial, or whatever the reason why it would be a particular level. So that's in the written part, but in the table you just put level 1, level 2 in the table itself.